Can you help explain the difference between T cell and B cell mediated or?
So a big part of the diagnosis of PNS focuses on the identification of the syndrome, followed by identification of antibodies in the spinal fluid or blood. Antibodies are made by B cells. Some of these antibodies are directly pathogenic. What that means is that the antibody itself can cause problems. In some instances, the antibodies are just biomarkers. They're not directly causing problems, but they're rather activating other cells, for example, T cells, to cause damage, to cause neuronal cell loss, to kill your own cells. So we know that in the more traditional paraneoplastic syndromes like cerebellar degeneration, for example, when you look under the microscope, what's going on, we know that those Purkinje cells, for example, are being directly killed by T cells. So B cells are, on the other hand, in charge of producing antibodies, secreting pro-inflammatory substances that can recruit other cells. So all in all, at the moment, most of the treatments really have an effect on both. But I do think that a big area that is an unmet need is to identify treatments that can be more effective at targeting T cells, really, because we know that a lot of the pathology is caused by that.
And is there currently any research that is promising that's addressing the T cells attacking the Purkinje cells?
Yeah, I know that there are groups looking at specific biomarkers on those, and specific also ways to use medications that are already approved for other things that we know can work in an effort to treat these so-called orphan diseases. So. I think that ultimately it will be a very individualized medicine type approach that will help, essentially, depending on the presentation and what we're seeing in the spinal fluid of the patients. It will help us maybe, hopefully, in the future, make decisions that can be more targeting, if you can say.
Well, we look forward to seeing what that research is, and hopefully being a part of seeing what the future and specialized treatment will be.